Thank you. Good afternoon, everybody. My name is Sheethal. I'm the Director of Rehab here. Today, I am going to just give you a little bit of information on the knee, the what, the why, the pain, and the strength. Before we do that, I did want to just say to everyone, it has been great seeing everyone in the last week. I know things are changing very quickly. We are all worried, and I completely understand that, so please be safe. Please be diligent. The therapy department is open, of course. We are essential. We're there for you. We're following all precautions with PPE. So those of you that are already coming down, please feel safe. If you have any concerns, let me know. Those of you that are hesitating or have questions, let's just give me a call and we can definitely talk. All right, let's get on with today's presentation, the knee. So let's go over the anatomy of the knee. It is the largest joint in the body. It is actually the most complex joint in the body. And when I show you some of the pictures, one of the pictures, you'll see why. As we know, I have my dancing skeleton guy here. But as you know that song, it connects the thigh bone to the leg bone and so on, and it really does. And that is the reason, because it's in between two different larger bones, one of them being the femur, the thigh bone, which is actually the longest bone in the body. It really does affect us in many different ways, and we'll definitely get to that. Of course, the other parts of it are the fibula, which is the side bone within our leg. And then, of course, the tibia, the kneecap, and you have the cartilage and the ligaments that also make up the knee joint. There we go. All right. So just a couple of the things. So there's your kneecap, the patella, of course. Down here, you have this larger bone, that's your tibia. Down here, you have your side bone, which helps to make also the end of it part of your ankle. That's your fibula. And then up here, behind your quadriceps muscle, is your femur, the longest bone in the body. So when I say it's complex, you can see it really is. You have so many different components coming in, right? So just looking at more of the outside of that bony component, we have all kinds of tendons that are coming through. So yes, this quadriceps muscle, the tendon attaches right over here. And actually the retinaculum will come right over the kneecap and then attach to what we call the patellar tendon. So it really is, as we say, attached. Those two bones are attached by many components here. Excuse me. Then you also have your hamstrings that come around and attach right around into your bone, right below here into the tibia. So you have two large muscle bulks that are coming into play. Your quadriceps, and of course behind the thigh is your hamstrings. Then within that joint space, we of course have our cartilage that cushions. We have our menisci, your lateral and your medial meniscus. And do remember, and I think so many of you all may even be familiar with that, is the meniscal surgeries. When you have a slight tear, they have to go in, and hopefully it's just a small arthroscopy surgery, and they can just remove those sections out. You also have other ligaments coming into play. We have our anterior cruciate ligament, our posterior cruciate, so that's your ACL. We see this on a lot of the football players. Recently had a couple of ACL surgeries and are now in rehab for that. You also have these two ligaments right here on the side. If you can see, your medial collateral and your lateral collateral. Sometimes when you twist your knee, you'll feel pain on the inside of your knee or the outside of your knee, and that's what that is. You strain that ligament. You can also tear it when you get your ACL tear, your anterior cruciate, and then it's, of course, more of a hefty of a surgery. Okay. So basically that tells you why the knee joint is one of the most complex in the body. All right. So what are the functions of the knee? We're going to go over just very basic things, as we all pretty much know what our knee does for us, but just to sort of hit on those topics. It provides us with mobility, of course, helps us to move. It supports the body during dynamic and stable activities. So stable activities, you're going to work the hip and the knee work together. And also, not listed here, but of course, your ankle and your knee work together. And then dynamically for squatting and sitting activities, and of course, your walking. Let's go on to some of the joint conditions that we may sometimes experience. So we can definitely have specific injuries. I touched base on the ACL or ligament injuries, any kind of really and I mentioned football. We're in football season now, and you can tell as you twist and you fall, you can definitely pull that ACL ligament out. You can completely tear it, or it just may be a strain where you feel a little bit of wobble in your knee. Fracture, again, it could be your patellar fracture, it can be your tibia, it can be your fibula, so one of the leg bones, that can definitely happen. A torn meniscus, we talked about just a little bit earlier. Bursitis, because we do have a bursa right there. And tendonitis, which is just the inflammation of the tendons. And those tendons, as we spoke of in the anatomy, and actually let me just go back, I'm sorry, is you've got your hamstring tendons that are coming through. You've got your quadriceps tendon or your patellar tendon. So there's definitely quite a few opportunities for us to injure our tendon or to have it inflamed. All right. Other joint conditions can be actual medical issues where you have a loose body within the knee joint. You can have IT band, which is your iliotibial band syndrome. You can have an actual patellar dislocation. And this last one's really important, hip or foot pain. And I've kind of touched on that before with you all, is because that knee joint is connecting something higher up and is connecting something lower down, right? So you have a hip joint and you have an ankle joint below. So if there is something going on with your knee, it really can affect up the chain or below the chain, either way. All right. Other joint conditions, of course, are arthritis. I won't really go into details about this. I did an arthritis presentation, I think it was either earlier this year or late last year, that we really talked in detail about each of these different types of arthritis. So first is, of course, osteoarthritis. Having rheumatoid arthritis can affect any joint. Many times it is more of our hands, wrists, and fingers. However, it can also affect our knee joint. Gout or pseudo-gout. Those of you that have had gout or have gout, you do know sometimes that's one of your first joints. It could be ankle or knee that really inflames. It's that shiny kind of red coloring and swelling that you're seeing. And of course, there's septic arthritis as well. And all of these, of course, will cause pain, and hence we will see a lot of the issues that you may have with walking or any weight-bearing activities. Okay. All right, and then I just added in PFP, patellofemoral pain, but really any kind of pain, right? It doesn't have to be the pain you get underneath your kneecap and above your femur. It could truly be any kind of pain that you're having in your muscle or your joint or your tendon. Okay. So let's move on a little bit to risk factors. So I'm going to name some that some may actually seem quite obvious and some may not seem quite obvious. So let's see what we find. Excess weight, lack of muscle flexibility or strength, certain sports or occupations, prior injury, and hip and ankle issues. So let's go to the excess weight. What really it is any time, many females may be able to relate to this, is when we're pregnant and we obviously have more weight on us. You'll notice it's not just our stomach that is causing us to trip and fall and having difficulty get up, but truly it's that extra added weight. We haven't suddenly gotten taller. We are still the same height we were, but that weight is causing extra pain in our hip and knees. And what ends up happening, let's say for every pound of weight that you're gaining, every 4 pounds that you are gaining, your joint feels like it's 10 pounds of weight with each step. So it's if I gain 4 pounds, I feel like it's 40 pounds, right? So just remember that our joints really feel the effects of any amount of weight that we've gained. Lack of muscle flexibility or strength. I think strength is pretty obvious. If we're weak, we really have trouble, whether it's endurance or really taking steps up, climbing things, whether it be the curb, getting in and out of the car, going from a sitting to a standing position. Those are going to cause issues. But why muscle flexibility? What happens is if I am not as flexible as I should be, and I am trying to move around or I'm trying to bend down, what happens on our knee joint is if one muscle is tighter than the other, and we'll take the hamstrings, a lot of our hamstrings are tight, excuse me, is if my hamstrings are tight and my quads are fine or loose, whichever way, or slightly tight, what happens is that the lever arm changes on our joint. And so that hamstring muscle, because it's tight, it's pulling back on our knee joint where it shouldn't be pulled that much. So flexibility really, really matters. So those classes that you all are doing, I know they're all virtual now, and they really do focus on stretching. So don't forget the stretching portion of your exercises. Certain sports and occupations, we mentioned football, any really kind of contact sport is a risk factor. Occupations, we can look at anything that is causing repetitive movement, such as factory jobs. You're standing for a long time. You're constantly doing the same motion repetitively through the day. Definitely do not want to do that. Prior injury. So if I've injured myself when I'm 16, more likely than not, when I'm 60, I may feel that a little bit more. Now, a way to combat that is, of course, to look at your strength and flexibility and the amount of weight that you have on your body. And we come back to this again, hip and ankle issues. Those are really key. You've got to have, it's not just your knee joint, it's that whole leg, it's that whole lower limb, right? So you've got the hip joint, the ankle joint, and then, of course, the knee joint. They all need to be able to work together. Okay, let's move on. All right, so the most exciting part, right, of all this is the therapeutic exercises. So there are so many other, I'm losing my word, I'm trying to think. There are so many other options for treatment. We get that, whether it's pain medication, something over the counter, some sort of an injection. However, this we feel like is the easiest one, right? Not only because you have therapy down here, but just on your own. There's so many things that you all can do. So we'll start with the basics, and we'll kind of formulate some sort of a plan. So therapeutic exercises, we have what we call closed chain versus open chain. Closed, of course, is when your foot is planted, and that way you're not free form. You're actually planted, and all the exercises are coming above your foot. Open chain is when your foot is not on the floor, so clearly it's a closed chain. And we'll go over some specific exercises, so I'm hoping that helps to make it more understandable. All right, so closed chain, I'm actually going to come up in front of the screen, so hopefully maybe they can turn the camera towards me. I'm not sure. Is that possible, Kai? Maybe? Okay. Going to put this in here. All right, so closed chain. Anywhere where my feet are planted. So the first one is squats, right? So feet are hip width apart, and you're just squatting, and that's just a simple squat. Now, I may only be able to go to here, or I may be able to go here, or I may be able to go further down. So just remember, it's all curtailed to what you can do. Lunges, of course, again, closed chain because my feet are planted, one foot in front of the other. I'm actually going to turn to the side this way, and then that's a lunge. Really, we want this further back for more balance, and then you come right back up. Okay, so all these are strengthening your quad muscles, to some extent your hamstrings, but really your quads. Step ups, I don't have a step in here, but if we had a 4-inch step, it's just where one foot is up on the step, and then I'm just coming up, and I'm coming down. I'm coming up. So this leg, the back leg is obviously not closed chain, but that front leg, The foot is planted on the step. You're going up and down. Another one, the leg press, it's a machine that you'll see and you guys are all familiar with, and that's in the gym, and that's a closed chain because your feet are planted against that plate, and then you're just pushing it forwards and backwards. The last one is a little bit harder. It's similar to the step where you're going up and down, but if you had a TheraBand and you start off in this bent knee position, and then you're just straightening it out. You're bending the knee, and you're straightening it out. So that's a little bit of a lower level exercise. All right, go on. So open chain would be any quadricep machine that you see in any of the gyms. So you're sitting there and you're just sitting in some sort of a seated position, and then you're pushing that weight out and back. So my foot, again, is not touching the floor. It's not planted. I'm just doing that. Any of the hamstring machines are open chain, whether you're sitting, starting from here, and you're pulling the weight back, or the one where you're laying on your stomach and you're pulling the weight up. Either one of those or your open chain hamstring exercises. And if we need to go to a lower level, right, after surgery or if you're in pain, the straight leg raise. So I'm lying down on my back and my leg is straight, and I'm just taking it straight up and straight down. And then, of course, your quad sets, you're laying down and you're squeezing the knee into the bed or mat table that you're on. All right. I have been constantly talking about your ankle and your hip and your ankle and your hip. So why is that, right? So if my let's say if my ankle is not strong or it's unstable, so I'm walking off, and I know Kai may not be able to get this, which is fine, but if this is my foot, and I'm walking instead of normally heel to toe, but I'm walking sort of on the outside of my foot, or I'm completely pronated like I am, walking on the inside. Well, what happens to that knee as you're doing that? It's really affecting the inside of that knee, and if you go back and think about the anatomy, on the inside of that knee, we have the MCL, the medial collateral ligament. So constantly, I'm putting pressure into that MCL all the time with every step I take. So then I'm always sore on the inside, right? So we need to definitely work on our ankle strength. We're going to jump down to the bottom, the open chain TheraBand. And you all that have come to therapy for your foot or knee have done it. And it's just doing all planes of exercises. So if this is my foot, this is my ankle, rather than my wrist and hand, I'm pulling in, or I'm pulling out, or I'm pulling up and down. That's your open chain TheraBand exercise. The other one is heel raises, and that's closed chain, and that's just, I'll do it on my heels. And again, I don't know if you can get that, but you're just going up and down to strengthen those calf muscles, which are actually attached to the knee and the ankle. And same thing, it's just you're going up on your toes and coming down. Unilateral stance. So we bring balance, right? When we have decreased strength, we also have decreased balance. So we've talked about balance on my last month's talk, right? Balance and allergies. You can hold on to something. And just standing, barefoot is really the best because you're not supported at all within your shoe. But you'll just stand there. And then if that gets too easy, you can stand without holding on. And you may not be able to see, but my foot is definitely shaking. It's trying to find that balance and it's trying to make sure that I don't topple over. Excuse me, I didn't mean to turn my back at you all. Okay. All right. We go to the hip. Again, going back to the wellness center, the gym that we have here, you have, I believe in our gym, we have only the standing hip machine. And so you know that you can go in all planes. You can kick out, which is your hip abduction. You can turn. You can do the hip extension. You can turn again, and you can do the hip flexion. Now, some of the gyms outside of here have the sitting ones where you're just opening your legs with the knees bent, or you're squeezing in. So you're getting the inner thigh, and you're getting the outer thigh. You can also do the TheraBand exercises in supine or standing. You'll notice the picture I have up here. He's laying on a mat, and he's just kicking his hip out. There are so many different exercises that you can really do for any of these joints. Prone, I don't have my the massage treatment table out here, but that's just you in all fours. So on your hands and knees, and you know what, I'm going to turn so I can hold on. And then you are just either kicking up or you can kick out like this, sort of like a fire hydrant position. Any of those to really get all these muscles onto your hip. All right. We went over this with the standing hip machine, but you can also have a TheraBand. And again, you could kick forward, you could kick out to the side, or with the TheraBand, you could kick out straight to the back. And there's your prone. Okay, I'm going to go back just a second. All right, let me grab this. So the reason we went through all these exercises, right, the hip exercises that are all in standing, sitting, it's not a program for you. I'm not creating this individually for you. So some of these may be appropriate for your level, some may not be appropriate for your level. Really, it depends on the type of pain you're having. Sometimes we just get some joint stiffness or soreness, and we really do need to keep up with some strengthening exercises or some stretching exercises and programs. If your pain is severe and you're just not able to get it under control, I definitely, of course, recommend you going to see your primary or an orthopedist, or to come down and talk with me and or Jenna. I know I don't really have the opportunity to do questions and answers like I usually do, but if you do have questions, please feel free to email me or get in touch with Courtney. I believe she did send the PowerPoint presentation this time, so hopefully you can look at that and then pull out questions if you need. Thank you so much for listening. And again, everyone, please stay safe, and I will see you around. Thank you so much. Have a great day.